Good afternoon, everyone, and thank you for joining today to view this presentation over sleep hygiene. My name is Kayla Rogers, and I am an education and outreach coordinator for the Women's Fund. And today we have this free virtual presentation over sleep hygiene. So to give a little background for those who are not very familiar with the Women's Fund, we are a not-for-profit in Houston that provides tools to women and girls in Houston and the greater Houston area so that they can become advocates for their own health. And we do this through focused seminars like our virtual presentation series, curriculum-based classes, and publications. All of our publications are completely free. You can find them on our website, thewomensfund.org, or you can utilize this little QR code and it will take you directly to the publications page on our website. Again, all of our publications are free, and if you would like to download them from our website, you're more than welcome to. If you would like physical copies of our publications, once we return to the office, we would be more than willing to get those ready for you. So today we are going to be talking about the benefits of sleep. We'll also cover the sleep cycle. We'll talk a bit about sleep deficiency and ways that you can improve sleep, and then we'll do a review and a closing. By the end of this session, I hope that participants are able to list 3 benefits of sleep, identify 2 signs of sleep disorders, and finally state 3 ways to improve sleep. So we discuss quite a bit of stuff during this presentation, but I'm hopeful that you will at least walk away with these 3 things. I'm going to go ahead and turn off my camera just because the quality tends to be a little better when we are just using audio. So I'm going to go ahead and stop my video at this point. Okay, so like eating, drinking, and breathing, sleep is a basic human need and is a vital part of the foundation for good health and well-being. I know when we think about taking care of ourselves, we typically tend to think of nutrition or physical activity, but sleep is an essential part of our health. So there are many benefits that come with getting good sleep. I'm going to cover some of these benefits. This is in no way an exhaustive list, but these are some of the benefits of getting good sleep. So the first is that it supports healthy growth and development. Deep sleep triggers the body to release a hormone that promotes normal growth and development in children and teens, but also boosts muscle mass and helps repair tissues and cells in children, teens, and adults. So we tend to think that growth and development when we think of children or younger children, but the benefits of good sleep are that it is helping us with growth and development throughout our lifetime. Another benefit is a sharper brain. So when we get good rest, our memory, our learning, our attention, our ability to make decisions, and our creativity are all improved. Next, we have mood boost. So when we sleep, our brain processes emotions, and it needs this time to recognize and react in the right way. Also, it can help improve our outlook on life. So when we get a good night's sleep, we kind of reset the button for a bad day, and we're able to improve our outlook on life and ultimately be better prepared to meet challenges. And I'm not sure about you, but I know that if I wake up and I've had a good night's sleep, I am more positive. I'm ready to take on the day. Little things don't bother me as much. If I've had a bad night's sleep, I tend to be kind of grumpy. Um, Little things may be blown out of proportion. So I definitely see changes in my mood based on how I sleep. Another benefit of good sleep, and this one is a big one, is having a healthier heart. So when we sleep, our blood pressure goes down, and this allows our heart and blood vessels to heal and repair, which is super important. And along with that muscle repair, we have athletic achievement. So for those who are competing athletes, you need to allow your body time to rest and for your muscles to repair and recover, and that happens with sleep. Another benefit is steadier blood sugar. So as we sleep, the levels of glucose in our blood drop, and actually reaching and remaining in deep sleep helps to lessen the likelihood of type 2 diabetes, which is pretty cool. Germ fighting is another benefit of sleep. So, our immune system really relies on sleep to stay healthy. And if we have ongoing lack of sleep, this can change the way that our immune cells work. They may not be responding as quickly or attacking as quickly. And so, you may find that you are getting sick more frequently. But if you're getting good sleep, your immune cells are working properly and they are able to better attack any germs that may lead to illness or disease. And the final benefit that I'm going to be discussing today is weight control. When we have good sleep, we have better hormone regulation of the hormones leptin and ghrelin. So leptin is the hormone that makes you feel full, and ghrelin makes you feel hungry. So when you're not getting good sleep, or enough sleep, the level of ghrelin goes up and leptin goes down, making you feel hungry, or hungrier than you would if you were well rested. So, getting good sleep is really important for keeping these hormones regulated. So, now we're going to talk about what exactly it is that makes you sleep. And this is two internal biological mechanisms. The first is circadian rhythms, and these are physical, mental, and behavioral changes that follow a daily cycle. They're produced and regulated by our biological clocks. The second is sleep-wake homeostasis, and this keeps track of your need for sleep. So the homeostatic sleep drive reminds the body to sleep after a certain amount of time, and it regulates your sleep intensity. We're actually going to spend a little more time on circadian rhythms. So circadian rhythms are controlled by two processes that interact. So the first is the pressure to sleep, and the second is the internal body clock. So with the pressure to sleep, while we are awake, adenosine levels in the brain are rising. And these levels, as they rise, signal the body toward sleep. As we sleep, the body breaks down the adenosine. The second process that we're going to look at is this internal body clock, which is in sync with environmental cues, so lightness and darkness. The hormone melatonin, which causes us to feel drowsy, is released by the body when it's dark outside or when it's dark. And so as the evening wears on, melatonin in our body peaks, and it usually peaks in the evening when we start feeling tired. On the other hand, cortisol is released by the body as the sun rises to help prepare the body to wake up. So that is pretty interesting, those environmental cues and kind of the hormone regulation that is happening to make us sleep and then to bring us to wake. It's important to know that the rhythm and timing of the body clock changes as we age. And we see this with newborns and young children versus teenagers. So newborns and young children need more sleep because they are growing and developing. It's not uncommon for babies, newborn babies, to sleep 16 hours a day, or for younger children to need naps or to go to bed earlier in the evening. Teenagers, on the other hand, tend to have later bedtimes or wake up later in the morning. And that has to do with the timing and release of the peak of melatonin within the 24-hour cycle. So for teenagers, that peak happens later in the cycle than it does for younger children or even older adults. There are two types of sleep. The first is rapid eye movement, or REM sleep, and the second is non-rapid eye movement, or non-REM sleep. So your ability to function and feel well during the day depends on if you're getting enough sleep and enough of each type of sleep. So throughout the night, the non-REM and REM sleep occur in a regular pattern of 3 to 5 cycles. So we will go through a cycle 3 to 5 times per night. Now to speak a little bit on the sleep cycle. So the sleep cycle is made up of 4 stages. The first 3 are non-REM sleep, and the 4th stage is REM sleep. So during the stage 1 non-REM sleep, you're transitioning from wakefulness to sleep. So this is a short, relatively light sleep period that lasts several minutes. During this stage, your heartbeat, breathing, and eye movements will slow, your muscles will relax, and you'll experience occasional twitches, and your brain waves begin to slow from their daytime wakefulness patterns. This is also the stage where you may feel as if you're falling. So if you've ever been drifting off to sleep and then your body kind of jerks, or you wake up suddenly because you had this sensation that you were falling, it's likely that you were in stage 1 non-REM sleep. Stage 2 non-REM sleep is a period of light sleep before you enter a deeper sleep. So during this stage, your heartbeat and breathing will slow, your muscles will relax even further, your body temperature will drop, your eye movements will stop, and your brainwave activity slows, but is marked by brief bursts of electrical activity. You spend more of your repeated sleep cycles in stage 2 than any other sleep stage, which is pretty interesting. And during this stage, you may be difficult to awaken. Stage 3 non-REM sleep is the period of deep sleep that we need in order to feel refreshed when we wake up in the morning. It occurs in longer periods during the first half of the night. And during this stage, your heartbeat and breathing slow to their lowest levels during sleep. Your muscles, again, are relaxed. Again, it may be difficult to awaken you, and your brain waves become even slower. So if you talk in your sleep or you sleepwalk, it is likely that this is a stage that would be occurring, stage 3. The final stage of the sleep cycle is REM sleep, and this occurs about an hour and a half after you fall asleep. Your eyes move rapidly from side to side behind your closed eyelids. Mixed frequency brainwave activity becomes closer to that seen in wakefulness. Your breathing becomes faster and irregular. Your heart rate and blood pressure increase, and your arm and leg muscles become temporarily paralyzed. But this isn't necessarily a bad thing because it keeps us from acting out our dreams. Speaking of dreams, most of your dreaming occurs during REM sleep. And as you age, you sleep less of your time in REM sleep. So this is our dreaming stage. Okay. So now that we've kind of talked about what sleep is, some of the benefits of good sleep and the sleep cycle, we're now going to transition and we're going to start talking about issues with sleep. your sleep deficiency. So, sleep deficiency occurs if you have one or more of the following. If you don't get enough sleep or sleep deprivation, if you sleep at the wrong time of the day, so you're not in sync with your body's natural biological clock, you don't sleep well or get all of the different types of sleep that your body needs, and you have a sleep disorder, or you have a sleep disorder that prevents you from getting enough sleep or causes poor sleep quality. Okay. So sleep deficiency is very common. An estimated 50 to 70 million Americans have chronic sleep disorders. 1/3 of US adults report they usually get less than the recommended amount of sleep. And nearly 40% of adults report falling asleep during the day without meaning to at least once a month. So clearly, sleep deficiency is prevalent. It is not an unusual issue to have. Who is at risk for sleep deficiency? So some of these might actually surprise you, some of them maybe not so much. Those who have limited time available for sleep. So this would include caregivers or people who work long hours, or even people who have more than one job, right? The more responsibility you have, maybe that you're limiting the time that you have for sleep. Those who have schedules that conflict with their internal body clocks. So this would be shift workers or people who travel a lot for work, right? Their schedules are kind of in conflict with what their body naturally wants to do as far as sleep goes. Those who make lifestyle choices that prevent them from getting enough sleep. So this would be, people who don't make time for sleep, people who are taking medications to help them stay awake, or people who are abusing alcohol or drugs. People who have undiagnosed or untreated medical problems, or medical conditions, or take medicines that interfere with sleep. So some of those conditions could be heart failure, heart disease, obesity, diabetes, hypertension, stroke, depression, or attention deficit hyperactivity disorder, commonly referred to as ADHD. I've mentioned sleep disorders a few times in this presentation already, but maybe you don't know what sleep disorders are. Sleep disorders are conditions that disturb your normal sleep patterns, and there are more than 80 different sleep disorders. The causes for sleep disorders are different for different sleep disorders, but some of them include other conditions such as heart disease, lung disease, nerve disorders, and pain, mental illness, including anxiety and depression, medications. Again, some medicines can lead to issues with sleep, genetics, and sometimes the cause is unknown. So while there are over 80 different sleep disorders, we are going to be focusing on 4 here shortly. But before we do that, I want to discuss some of the signs and symptoms of sleep disorders. So if you regularly take more than 30 minutes each night to fall asleep, so say you get into bed and an hour has gone by, an hour and a half has gone by, but this is happening on a regular basis. This isn't something that happens every blue moon, but you frequently have trouble falling asleep. That could be a sign that you have a sleep disorder. Another sign could be that you regularly wake up several times each night and then you have trouble going back to sleep, or you wake up too early in the morning. Other signs could be that your bed partner says you snore loudly, you snort, you gasp, you make choking sounds, or you stop breathing for short periods. Or your bed partner notices that your legs and arms jerk often during sleep. Other signs could be that you have a creeping, tingling, or crawling feeling in your legs or arms that is relieved by moving or massaging them. You have vivid dreamlike experiences while falling asleep or dozing. Or you have episodes of sudden muscle weakness when you're angry or fearful or when you laugh. The last group of symptoms that we're going to look at here are you often feel sleepy during the day, take frequent naps, or fall asleep at the wrong times of the day, or you often feel as though you cannot move when you first wake up. So if you experience any of these symptoms, it could be that you have a sleep disorder and you would want to consult with your doctor for further evaluation. So into those 4 common sleep disorders that I said we're going to talk about. The first is insomnia. And insomnia is characterized by the inability to initiate or maintain sleep. So if you have trouble falling asleep or trouble staying asleep, this is the most common sleep disorder. Diagnosis is by healthcare providers. So they will first rule out other potential causes or other things that could be the reason why you're having problems sleeping. It could be other sleep disorders. It could be the side effect of medication that you're taking. It could be substance abuse, depression, or other previously undetected illnesses. Treatment can include a combination of sedative, hypnotic, or sedating antidepressant medications, along with behavioral techniques to promote regular sleep. And we are going to be talking a little bit more about behavioral techniques throughout the rest of the presentation. The next sleep disorder that I'm going to discuss is narcolepsy. And this is excessive daytime sleepiness combined with sudden muscle weakness, and these are considered hallmark signs. So episodes of narcolepsy have often been described as sleep attacks. The diagnosis here is a clinical examination and medical history. You may be asked to keep a sleep journal for your physician to further evaluate. The most specific and distinguishing symptom of narcolepsy is cataplexy. And this is the sudden loss of muscle tone while a person is awake. It leads to weakness and loss of voluntary muscle control. Okay, so this is the most distinguishing symptom of narcolepsy, is this loss of muscle control and weakness. So during your diagnosis, they may ask if you have experienced cataplexy, and they may do a physical exam to rule out other conditions. So this physical exam could include a polysomnogram, PSG, or a sleep study. And this study is an overnight recording of brain and muscle activity, breathing, and eye movements. It's just an opportunity for the physician to get a better idea of what is happening with your body while you're asleep. And the next test that could be conducted is the multiple sleep latency test, or MSLT. This test is a test that looks at how quickly a person falls asleep and whether or not they enter REM sleep. So you will be asked to take numerous naps, and you will be evaluated based on how long it took you to fall asleep. If you entered the REM cycle, how long it took you to enter that REM cycle, and so forth. So treatment here could include stimulant medications combined with behavioral interventions such as regularly scheduled naps to minimize the potential disruptiveness of narcolepsy on the individual's life. So you can only imagine how disruptive this would be to experience these sleep attacks. The third sleep disorder that we will be discussing is restless leg syndrome, or RLS. So this is characterized by an unpleasant creeping sensation, often feeling like it's originating in the lower legs, but often associated with aches and pains throughout the legs. So this would be if you experience those uncomfortable sensations in your legs that is only alleviated by movement, such as walking or kicking. There's no specific test for RLS. It is a doctor's diagnosis, but they will look at a couple of things in order to make the diagnosis. So one is whether or not you experience strong and often overwhelming need or urge to move the legs that is often associated with abnormal, unpleasant, or uncomfortable sensations. So if you have this urge to move your legs because you are experiencing these uncomfortable sensations. The urge to move the legs starts or gets worse during rest or inactivity, is at least temporarily and partially or totally relieved by movements, and starts or is aggravated in the evening or night. And then lastly, the doctor is going to make sure that the above 4 features are not due to any other medical or behavioral condition. So ruling out that those things could be happening because of something else. Treatment includes a combination of medication to help correct the underlying dopamine abnormality, along with a medicine to promote sleep continuity in the treatment of RLS. So RLS has been associated with an abnormality in the neurotransmitter dopamine. And so one of the medications that could be prescribed would be to correct that abnormality. And the final sleep disorder that we're going to be discussing is sleep apnea. And this happens when breathing is interrupted during sleep, sometimes hundreds of times, during which the brain and body may not be getting enough oxygen. So this sleep disorder is characterized by periodic gasping or snorting noises, during which sleep is momentarily interrupted. I worked as a medical scribe for a few years and underneath multiple physicians. And a lot of times their patients who they worked with who had sleep apnea, it was their partners who would notice that they, it sounded like they couldn't breathe or they snore really loudly, which is pretty interesting. So if you have ever been told any of these things, it's definitely worth bringing up to your physician. So diagnosis is the polysomnogram or the sleep study. And again, this is that overnight recording of the brain and muscle activity, breathing, and eye movements. So the recordings are analyzed by a qualified sleep specialist to determine whether or not you have sleep apnea or another type of sleep disorder. Treatment really is dependent on cause. So if other medical problems are present, such as congestive heart failure or nasal obstruction, then the sleep apnea may resolve with treatment of those conditions. If it is true sleep apnea, a gentle air pressure administered during sleep may also be effective. So this is usually done with the nasal continuous positive airway pressure device, commonly referred to as the CPAP device. Okay, so we know that sleep deficiency is very common. We know that it can be caused by numerous things, including sleep disorders. And we've talked about the 4 common sleep disorders, but we haven't talked about the consequences of sleep deficiency. So some of the consequences include trouble with learning, focusing, reacting, making decisions, solving problems, controlling emotions and behavior, and coping with change. You may also feel frustrated, cranky, or worried in social situations. You may notice lower productivity at work and school, so taking longer to finish tasks or noticing that you're making more mistakes in your work than usual. It can also result in chronic health problems, including heart disease, kidney disease, hypertension, diabetes, stroke, obesity, and depression. And then the last consequence that I'm going to mention here is increased risk of accidents, both in your professional life and your personal life. Okay, so Now that we know some of the consequences and we've talked about the importance of getting enough sleep, how do you know how much sleep you should be getting? Well, we talked about it a little bit earlier in the presentation that newborns and younger children need more rest. And as you can see by this chart, that is definitely true. The amount of sleep that you need largely depends on your age. And as we age, we tend to need less sleep. So I'd say for adults 18 and older, that somewhere between 7 to 8 hours of sleep per night is a safe bet. Luckily, if you are experiencing issues with sleep, there are some things that you can do at home to help potentially improve your sleep. So, this is where we're going to start talking about sleep hygiene. Sleep hygiene is a series of healthy sleep habits that can improve your ability to fall asleep and stay asleep. So, the first 3 tips I have are go to bed and wake up at the same time every day. Try to keep the same sleep schedule on weeknights and weekends, and use the hour before bedtime for quiet time. These first 2 tips really do revolve around a schedule. So, setting a schedule for yourself and allowing yourself the time to get enough rest and enough sleep. When we get busy or we're feeling very stressed, sleep is typically the first thing that we cut to give ourselves more time. Um, Unfortunately, we saw all those consequences and things that could happen if we are not getting proper sleep. So we really do need to prioritize sleep and make sure that we are adding it into our schedule. And it's important that we keep a sleep schedule and we try to go to bed and wake up around the same time each day because we want to make sure that we are not throwing off our body's sleep wake rhythm. The third tip, use the hour before bed for quiet time. This is a really good tip, and I feel like this is something I could personally improve. Using this time before bed to kind of unwind. I know a lot of people like to watch TV or movies or be on their phone or their tablets before bedtime, but really we shouldn't be doing that. We are introducing artificial light into our space, and that light is going to tell us, remember we talked about environmental cues, it's going to tell us, hey, we should be awake right now, right? Instead of us winding down and getting more sleepy. So we want to eliminate any artificial light like screen time or TVs this hour before bed, and that can really help us to get better rest. The next 3 tips are avoid heavy and or large meals within a couple of hours of bedtime, avoid alcohol, nicotine, and caffeine before bedtime, and spend time outside every day and be physically active. So this first one, avoiding heavy meals. It's okay to have a light snack before bed, but you want to avoid anything too heavy because you don't want to have any issues with heartburn or indigestion that would make it difficult for you to get good sleep. Avoiding alcohol, nicotine, and caffeine. Some people will say that alcohol helps them fall asleep faster, but it doesn't allow you to get good rest in the second half of the night because that is when your body is processing the alcohol. So it can really disrupt sleep in the second half of the night. And nicotine and caffeine are stimulants. So you want to avoid these before bed because they can interfere with your sleep. The effects of caffeine can last as long as 8 hours. So if you are having trouble sleeping at night and you are the person who has coffee late in the afternoon, it could be that coffee that is interfering with your sleep later that night. And the last tip on this page, spend time outside every day and be physically active. It's important to expose yourself to sunlight during the day as well as darkness at night to help maintain the healthy sleep-wake cycle. And getting some physical activity, spending some time outside can drastically improve the quality of your sleep. The final 3 tips are to keep your bedroom quiet, cool, and dark. And this tip I feel is important. You want to make sure that your space is inviting and that it is relaxing. You want to be able to associate your bed with sleep. So making it as comfortable as possible. I apologize, it's raining. If you can hear that thunder, it's very loud. Making your bed as comfortable as possible so that you are in a nice space to get good rest. The next tip, take a hot bath or use relaxation techniques before bed. This is great. It helps you to kind of unwind and relax before you lay down to go to sleep. You may want to use this opportunity to take a hot bath or shower. You may want to journal, listen to relaxing music. Maybe you want to meditate. All of these things would be great to help kind of wind down. And then the final tip, for those of us who take naps during the day, if you notice that you're having difficulty sleeping at night or getting good rest, limit or eliminate the naps that you're taking during the day to help you get better sleep at night. Okay. So I have a few tips that may be helpful for a specific group of individuals, and that group is shift workers. So if you are a shift worker or you know a shift worker, you may find it helpful to take naps and increase the amount of time available for sleep. So if your body clock is, still wanting you to feel tired at night, but you have to work at night. So maybe increasing your naps if you're finding it difficult to sleep during the day when you should be sleeping if you're a shift worker. Keep the lights bright at work. Again, those environmental cues, that light will tell you you should be up and awake. Limit shift changes so your body clock can adjust if you are able to. Limit caffeine use to the first part of your shift, just like we limit caffeine to the first part of our day. Shift workers should limit it to the first part of their shift, because if they're drinking it at the end of their shift and then they go home and they want to go to sleep, that caffeine is still going to stay in their system. And then remove sound and light distractions in your bedroom during daytime sleep. So if you are working night shifts and you're sleeping during the day, you want to, again, make your room an inviting place. Make it as dark as you possibly can, as quiet as you can, to kind of limit those distractions so that you're able to get the best sleep. If you have tried some of these techniques, or if you believe that you have a sleep disorder, you definitely want to speak to your physician. So if you have identified some of those signs and symptoms as issues that you have, or if you have tried, to incorporate behavioral changes or lifestyle changes and you haven't seen any improvement in your sleep, definitely speak to your doctor. When you speak to your doctor, you want to make sure that you talk to them about how often you have trouble sleeping and how long you've had the problem, when you go to bed and get up on work days and days off, how long it takes you to fall asleep, how often you wake up at night, and how long it takes you to fall back asleep, whether you snore loudly and often or wake up gasping or feeling out of breath, how refreshed you feel when you wake up and how tired you feel during the day, and how often you doze off or have trouble staying awake, especially during routine tasks such as driving. If you are having trouble staying awake driving, that's definitely a problem, and you should definitely address that with your doctor. So when you speak to your doctor, they may ask you questions about personal routines and habits, such as your caffeine, tobacco, alcohol, and medication use. They may have you keep a sleep schedule. So they'll have you write down, when you fall, like how long you're sleeping, how you're feeling when you wake up. Um, they may have you take a sleep study, and they may do other diagnostic tests to rule out other problems or conditions. So, to close, sleep is a vital part of the foundation for health and well being. Just like physical activity, just like nutrition, sleep is so important for our bodies in order for us to function and be our best selves. Sleep deficiency can lead to numerous health and safety issues. So, it's important that if you are experiencing difficulties getting enough sleep, try working on improving your sleep hygiene or those behavioral things that you can try. And if problems persist, speak to your healthcare provider. If you believe that you have a sleep disorder, definitely speak to your healthcare provider. Okay. We saw the effects of poor sleep, and that's not something that you want to put off or prolong because it can definitely lead to serious health issues. Okay. Should you have any questions or comments regarding this presentation, please email us at healtheducator@thewomensfund.org. This is our program staff email address, and so we will get your questions and be able to give you an answer. Also, if you would please take the time to complete the survey. Here is the link and also the QR code. We really appreciate any feedback that you have from us. We are still fairly new to virtual presentations, and we would love to know how we are doing, what we could improve, maybe some topics that you would be interested in hearing about. So please, please, please take the time to do the survey. Our upcoming events, next week we will be talking about self-care, and in the coming weeks we will be talking about home and summer safety, work-life balance, nutrition and shopping on a budget, and self-empowerment. If you're ever interested in knowing what upcoming events we have, registering for events, you can visit our website, thewomensfund.org. You can also follow us on Facebook, Twitter, and Instagram. We frequently post, events that we have coming up, and we have some really great social media content as well. So I want to thank you for watching this presentation. Again, if you have any questions, email us at healtheducator@thewomensfund.org. Thank you so very much.